No, we actually recommend that patients sort of titrate their activity and don't go crazy when they have back pain, like if they like to exercise a lot, tone it back a little bit, but certainly don't lay in bed or on the couch all day. It actually will prolong the episode of low back pain. Every day that you lay around, it takes a day or two to get that back. So we recommend that people do continue moving around, taking care of themselves around the house and things like that. The mind-body connection, I think, is real, and I see a lot of patients all the time that have a lot, especially in the last 2 years, having a more sedentary lifestyle, a lot of stress with, the pandemic and changing of work habits and work setup. I see a lot of patients that have lower back pain and neck pain, and I think that all plays into it. People tend to hold their tension, I think, in different places of their body, and I think that may sound like a myth, but I think it's actually true.
It's very safe to live with one kidney. Some people are actually born with one kidney and they have a completely normal life. You are at less than 1% risk of developing kidney disease yourself if you donate a kidney. You can lead a completely normal life where you don't have to change your diet or change your alcohol intake or change your exercise. People think, oh, I donate one of 2 organs, that you lose 50% of your kidney function. You actually don't even lose 50% of your kidney function, you lose about 20%. Over time, the kidney is really smart and compensates for the one that was lost, so it functions better, more efficiently, and ends up making up for the kidney that was lost. If something happens to somebody's other kidney, there's a protection system in place where they get extra points that move them straight up to the top of the transplant list. So there's multiple layers of protection for somebody who wants to be a kidney donor.
From a population standpoint, there are about 25 million Americans who actually have asthma, out of which 5 million are kids with asthma. A lot of patients die from asthma every day. About 10 Americans die from asthma every day. From an individual patient standpoint, asthma actually can be quite lethal. It can go from being well controlled to making somebody severely ill, and patients can actually die from asthma. But all of that is preventable, both the morbidity as well as the cost, by taking appropriate medical care for asthma. We have some amazing drugs, medicines for asthma in the last several years. Tons of research has been done. In fact, having a normal life or normal exercise capacity is one of the goals for our patients when we manage their asthma.